The United States is now leading the world in positive COVID cases, and we have seen the exponential growth in many regions throughout the United States, and we've seen the negative impacts that has had on their healthcare system. The reality is we don't want that to be us in San Diego. As the chart you just saw indicates, we are in the early days of our community spread relative to many of those other jurisdictions. And in the early days, our actions are most important. They are most critical. The things that we do day in and day out over the course of the next few weeks will determine our trajectory at the tail end of situations like you see in other places where they're having great problems. And that is why we are reiterating to the public the essential nature of the directives that have been given around physical distancing, around personal hygiene and hand washing, around what to do if you are sick. Here at the county, we have launched all of our efforts with three kind of core things in mind, very straightforward. First, actions that are taken before the curve. This is our engagement, which started early in January, our public health declaration, a state of emergency, which was before we had a single positive case, and the things that we continue to do to this day, securing hotel rooms for isolation, installing hand washing stations, ramping up and trying to get more personal protective equipment from the state, from the feds, buying it on the open market, deploying hand washing stations, supporting homeless shelters, and so much else. The second part we do is the efforts around flattening the curve. These are the public health orders, closing schools, non-essential businesses, limitations in public gatherings and mass gatherings. These are all of the things that we need the collective buy-in and support of the public on. And then the third thing, which we talked about a bit yesterday, is efforts to raise the bar of our healthcare system capacity. This means getting more ventilators, better optimization of healthcare facilities and hospitals, the incredible work that they are doing, along with things that we can do here at the county to increase the availability and supply. And if we together do all of these three things, actions ahead of the curve, flatten the curve, raising the bar of our healthcare capacity, then it is our hope that we can make our way through this and protect our residents as best as possible. I want to quickly show you the graphical display of the cases that we are facing, we are reporting right now. You can see the current reporting is 58 new cases, which was posted last night, brings us to a total of 341 total cases in San Diego County of San Diego County residents. And then the next slide reflects the number of tests. Again, this is not the total number of tests conducted, as in the early days many tests were not reported to us. We are seeing increasing in testing and increasing in reporting of testing. You can see there are 1,087 tests reported for March 25th, which brings us to 5,055 total tests that we are reporting in the County of San Diego. We continue to take action to get as much testing capacity as we can, both internally into the county and in partnership with our community testing, with the private labs, and with everyone else that's out there. Now I will turn it over to Dr. Wooten for her Public Health Officer's report. Thank you.